That unexpected update here in Washington, White House Press Secretary Karine Jean-Pierre and COVID-19 coordinator Dr. Ashish Jha are set to speak today about high flu and COVID numbers. ABC News senior national policy reporter Ann Flaherty, along with ABC News contributor and chief innovation officer at Boston Children's Hospital, John Brownstein, join me now while we do wait for that live event. And cases, hospitalizations, deaths, all on the rise right now after Thanksgiving, where everybody got together. Where do we stand now, just 10 days before Christmas?
So, Kira, those COVID numbers are trending upward. We have about 1.5 times more cases and death numbers than we did this time last week. That's alarming administration officials. Biden realizes he's got a COVID problem heading into winter, especially with these high flu numbers. So what we know is that Biden says he's going to send out these for free tests. You can sign up for them online. They say that's really important that you test, because if you test early, you know you've got COVID. Then you can get the antiviral Paxlovid. Really important for people, seniors, older people over 50. Not so important for younger people, but it can prevent hospitalization and death.
So, Dr. Brownstein, let's talk about your advice to families then gathering for the holidays, just in light of everything that we're learning, and so many of us and our family members are getting sick.
Yeah, well, Kira, you know, a silver lining, at least, of all of this last 3 years of living with COVID is that we know how to protect ourselves from respiratory viruses. So what we need to do is make sure that you're planning your holiday around your most vulnerable, newborns, elderly, immunocompromised, and make sure that we're protecting those vulnerable populations by wearing a mask, by staying home if you're sick. If you've been exposed to flu or RSV or COVID, stay home. As Ann said, test for COVID, ensure you have good ventilation. And we do have vaccines. We have the vaccine against flu that's a good match, and we have those COVID boosters that are so essential right now.
But, John, can I ask you about that? Because our whole family got the flu shot, and we all got the flu. So I'm struggling with the whole flu shot thing.
Yeah. Well, you know, flu shots aren't perfect, right? And we know this to be true, that you don't have perfect protection, but we do know, just like the COVID shot, that once you've had it and have that baseline protection, that your outcomes are going to be so much better. If you have the flu shot, the risk of severe consequences, hospitalization, and death go down dramatically, and your risk of spreading that virus also goes down. So nothing is foolproof, but having that base level protection helps yourself, helps the broader community, especially helps those that are immunocompromised that can't mount an effective response with the flu shot.
And you and I are moms. We were talking about this the other day in the Bureau. You know, the flu numbers are pretty high. So what are you learning from the CDC, and what's the CDC telling healthcare providers?
So, we are hearing about 7,300 deaths so far this season. That is remarkably high. Hospitalizations are the highest they've been in a decade. And the CDC is warning that you could see some problems with the distribution of antivirals like Tamiflu that you would take for flu. You could talk to your doctor about this. If they don't have immediate access to it, they can get a generic, for example. There are other options. They say there are no real shortages per se. It's just a matter of time, making sure that it's in the right spots at the right time when flu numbers go up. But certainly those flu cases, it's almost more concerning than COVID at this point with those numbers. CDC saying, we were hit early, we were hit hard, so people need to get that flu shot, because even though it might not prevent you from getting sick, as John said, it could, improve those outcomes.
So, John, let's just talk about Tamiflu, for example, even Tylenol, ibuprofen, not easy to get. Ibuprofen and Tylenol in a couple pharmacies locally were cleaned right off the shelves in my neighborhood. And then Tamiflu, we had to drive about 35 minutes out to another pharmacy because it was sold out at a couple here in our hood. So, what's your advice? What do we do? Do we start thinking about, okay, if we haven't gotten sick, let's get our doctor to prescribe it now and have it on standby?
Well, there is a thought about having some supply ready on hand, and that's been discussed for many years. So, but for now, the idea is that there's still enough out there to get. It will take extra time. Unfortunately, you had to go through that, which is not fun, and I apologize that you had to deal with that. But it is out there, and there are alternatives. As Ann said, we have the Tamiflu brand name, but we also have the generic. So there's some options. There's ability to move from one brand to the other. But the issue is that that supply should ramp up. We're hitting a really early flu season, so that's why potentially we're caught a little flat-footed. But for now, you'll just have to spend a little extra time, or use those online tools like GoodRx to find that prescription. It's out there, and unfortunately, it just takes a little extra work.
All right. Dan and John, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.